Hello, I'm Dr. Gerald Chodak and this is ProstateVideos.com. In this video, I want to relay to you the results of a recent study on high-intensity focused ultrasound that was reported in one of the medical journals. This treatment has been used in Europe for much longer than in the United States and is currently not approved for routine use in the United States. The question is, how good is this therapy compared to other treatments available? The authors reported their results on about 450 men who were followed about to 4 years. Half of the men were followed for 2 years or less. And they looked at the results in terms of controlling PSA. In other words, how often did the PSA not go up after the treatment was completed? And when we compare their results to similar types of studies done with other therapies, their results still look inferior. Now, it's of course very difficult to directly compare two studies done in two different locations with two different populations. But at least so far, the results that they're reporting for men with low risk or intermediate prostate cancer would appear to be not as good as achieved with other forms of therapy like surgery or radiation or seed implantation. The other problem patients should be aware of is that looking at the results with such a limited follow-up is problematic because it doesn't really tell us what's going to happen at 5 and 10 or 15 years down the road. With prostate cancer, the only real way to tell how men are doing is to have long-term follow-up in which we find out if the survival is being affected in a good way and comparing those results to other treatments that are being used. The bottom line is we can't say at this time whether or not high-intensity focused ultrasound is an adequate treatment for localized prostate cancer. Also, the authors of this study did not report any information about complications or side effects. And clearly, for a patient who's weighing his options, he needs to balance the trade-off between the pros and cons, the risks and the benefits. So we certainly need more information in this group of patients to be able to inform other patients what to expect. I believe that the current status of this treatment means that it's an experiment in progress, and until we have more long-term information, patients should be aware that at this time it's not an adequate therapy to compare against other therapies for the disease. I hope you'll find this information useful, and thank you for watching.